Is anyone here scared of going to the doctor or had a bad experience with them? I know I sure have. A little while ago, I had to get my first penicillin shot because my body physically couldn't handle antibiotics anymore. So I got it from this nurse who was cold, rude, cranky, and not very accommodating to how I was feeling. She made the experience so bad for me that the next time I had to get that shot, I was practically fighting my childhood nurse on getting it. But because she was my childhood nurse, we had a relationship. So she was accommodating to me, she listened to me, and she actually made the shot not feel as bad. The difference between these two nurses was their communication skills. One listened to me while the other one didn't. One was rude while one was very loving and caring, and it affected my outcome as a patient. I believe that this is happening way too often in the medical field, where people are rude as doctors or nurses to their patients, and it is causing them to have bad experiences. But the medical field is made for our patients, and I believe that we as doctors or future doctors need to have better communication skills. We often think that we have great communication skills, but a study by Ochsner Journal shows that 75% of surgeons surveyed think that they have good communication skills, but only 21% of their patients actually said that they did. Another study done by Al Alman, Markham, and Suzanne that published in a journal of healthcare management states that out of 2,756 of the highest ranking hospitals, only 21% of the hospitals actually had some good communication skills or no good communication skills at all. These studies are showing that there's a cry for help for good communication skills in our medical field. As the patient-physician relationship is the cornerstone for quality in healthcare, we as physicians and future physicians need to understand why better communication is needed and how we can improve it. It is needed because, one, it'll help our patients. It'll help them feel less scared and more heard, and it'll also help us as doctors. It'll help us with lawsuits. According to an article by Matt Farrow, majority of lawsuits are due to bad communication, because oftentimes we assume that the patient knows everything, but we are the ones with the degrees. We are the ones who are educated. They're coming to us for a reason. We need to let them know all the facts, all the risk factors, and not just our opinion. Because failure to provide adequate information can lead to assault from a medical professional. This can be avoided if we just lay out all the facts and communicate well. Better communication also allows for our patients to be satisfied. When they are satisfied, they come back to us. They recommend us to their friends and on public websites. And I, for one, know that I would like to have good recommendations out there. And oftentimes, those good recommendations or bad recommendations are due to communication skills. I have read ones that say, oh, this doctor was rude, or this doctor was very mean. But others say this doctor was excellent, this doctor was caring. I would rather be the caring and excellent doctor than the rude, mean one. So I think that we need to communicate better in order to have our patients satisfied, that then satisfies us, because then we have more people coming in and more business. And this communication doesn't require more time on our end. We're already spending time with these patients. We might as well communicate better for both their benefit and our benefit. So now we know why. And before I step into the how, I just want to address the fact that we are already doing a good job at this. We have programs such as HCAHPS and VPP that are helping our communication skills. VPP is a program that rewards or penalizes hospitals based off of performance in regards to patients' experience and outcomes. HCAHPS stands for Hospital Consumer Assessment of Healthcare Provides and Systems. This program is a national, standardized, publicly reported survey of patients' perspective and outcomes, according to this article, Center for Medicare and Medical Services. HCAHPS allows for comparisons for hospitals locally, regionally, and nationally. It helps hospitals see how they can improve, and they want to improve because their data is public. In the HCAHPS program, there comes a series of questions for the patients. These questions involve patients' experiences with their doctors and nurses, which can include the communication between their doctors and nurses to them. Both of these programs are great, but I think that we need to take this drive to better communication outside of the hospital and move it to other outpatient clinics, other clinics, and better our medical field as a whole, and not just the hospitals. So, Now on to the how we can communicate better to our patients. We first off need to think of them as real people. They have real feelings and real lives. So when they walk through that door, we need to be present, be in the moment. Don't be thinking about what you have later on that day. We need to smile, have good eye contact, address our patient by name. If it's their first time coming in, we need to introduce ourselves and let them introduce themselves. Have some small talk. It's not going to waste that much time. Build that relationship so that the next time they come back, you can ask them about something personal they brought up so that they feel like they were heard and not just a subject to be studied. Then we also need to have them bring up their agenda and concerns. After you've had your small talk, let them bring up their stuff first. That way, one, it saves you time, because if they bring it up later on in the conversation, then it's just going to waste your time. If they bring it up in the beginning, at least you can be addressing it and thinking of solutions throughout. It also lets them feel included and heard when you let them bring up their concerns, because then they realize that you are there for them and not them there for you. You can also avoid long appointments by not missing their emotional cues and showing them empathy. If someone is beating around the bush about something they're feeling, they obviously want to say something. Don't overestimate that or overstep that. Approach it. Let them be approachable for them to let them come to you about how they're feeling. That's what you're there for. If they're feeling anxious about something, let them talk to you about it. Because a study shown by JAMA says that when doctors missed empathetic cues, the appointment actually lasted for 20 minutes, whereas when the doctors didn't, it only lasted 17. Same went for the surgeons. If before surgery the doctors missed the cues, it was 17 and a half minutes, whereas if they didn't, it was only 12. So research shows that these patients want to be heard. We need to be listening to them, but not only listening to them, but focusing on their nonverbal. If they're fidgeting and nervous, try and calm their minds. If you had that relationship, it should be easy. You also need to be focusing on your nonverbal, our nonverbal as doctors. Turn your body towards them. Again, make good eye contact. Don't fidget, tap your foot, or cross your arms, or look at the clock, because then it shows that you're in a rush or annoyed or bored. That's not a way to make your patients feel included. Be present in the moment. Next, don't talk at them, but talk with them. Include them in their decisions, because when you include them, they'll actually want to produce more treatment. Have them repeat your plan of treatment. Last but not least, end with good communication. Thank them for coming in, summarize what they're going to do next and what you're going to do next. And leave with optimism and hope, because when you leave that room, that's what they're going to remember. So, through the studies mentioned, we see that the patient-physician relationship is the heart of medicine. And the heart only beats if practice continues. And the practice can only continue if the patient is happy. And the patient is happy when we as doctors have good communication. And good communication not only makes our patients feel less scared and more welcomed, but it helps us with lawsuits and gives us recommendations. So, we as doctors, who are also people, need to remember that our patients are also people with emotions. And that without these patients, we wouldn't have jobs. In fact, we wouldn't be doctors at all. So treat them well. Communicate with respect, with love and kindness, because they deserve it. We became doctors for them. Show them that. Show them you're not just another doctor to check them out. Show them that you're their doctor and that you care for them. Communicate well and love them well. Thank you.